Right, I want to welcome you to the Puzzle of Autism. We're going to be doing a basic presentation over autism. Feel free, we're going to go through a book. You're going to learn lots of great information that you can learn now as well as take back and use for educators, for parents, for family. Lots of good information that we're going to go through. First of all, I want to introduce myself. I am Tristina Alvestead. I teach in Missouri. I'm an early childhood special education teacher, and I'm also the district autism consultant.
And my name is Mary Jameson, and I'm from Virginia. I teach in Chesterfield County, Virginia, and I teach at the elementary level, and I teach students who have mild intellectual disabilities.
Right, we want to give a quick note of appreciation to Ada Savner-Hawker, who was an Autism Network coordinator who helped us in bringing together this presentation. She is with the Autism Society of America. So just a quick thanks for her help. Some things that we would like you to be thinking about as we go through our presentation, and then things that we will also be discussing. What is the definition of autism? What are the characteristics of students in the Autism Spectrum Disorder? What are some effective practices and strategies for educators? And what resources are available? So we would like to start off with what do educators need to know when it comes to the puzzle of autism? So if we could just share out some things that you think educators might need to know before entering their classrooms. Well, those are things we think we need to know. What are some things that we already know about students with autism? Well, let's get into what we do know. We do know that autism is the third most common developmental disability. We know that it currently affects 1 in 91 individuals. Just 2 years ago, it was 1 in 200, and 2 years later, we're seeing now 1 in 91 individuals will have some form of autism spectrum disorder. It's also interesting that it affects 1 in 58 boys. It's 4 times more often than we see it in girls. And I've been teaching for 14 years, and I have only been with 2 girl students with autism. Everyone else have been males, so that's definitely true in my case. And there currently is no medical test. There are medical diagnoses, there are educational diagnoses, but there is no magic, go get a blood test and you can get a diagnosis. So that kind of makes it difficult as well. We do know that it is the fastest growing developmental disability. So when you compare statistics, you can see in the 1990s that the U.S. population increased 13%, overall disabilities increased 16%, autism 172% increase. And so when you think about that, there's going to be some social and some economic and health impacts. And when we look at that, currently looking at $20 billion annually for the cost of autism. Now that includes research, insurance, educating, and then as they get older, housing, transportation, those kind of things. It is projected in the future that it could be approximately $90 billion a year in cost, and then a 10-year projection of $300 billion. And also interestingly, and hopefully things would change over time, but currently 90% of the current costs are for adults for services. Now, in the past few years, we have learned that the earlier that we can get to the students and start making an impact, that diagnosis and intervention can reduce costs by 2/3. So, we always hope that the more we know, the more we can help and reduce those costs.
In your handout, You have a handout of the diagnostic criteria for the DSM-4. You should have it in your handout materials. And as you look at that definition that they have on there, you can see that autism, the symptoms of autism can range from mild to severe. And no two cases will look alike. No two students look alike. And because it is a spectrum disorder, the complexity of the disorder also ranges. And the characteristics are unique to the individual. And they present differently from person to person. There are no two children alike. So I would like to share a story with you from a person who has autism. And her name is Therese Marie Ronan. And she shares what it feels like to be a person with autism. And she says that autism means having to watch how I feel every second that I'm awake. Autism means having challenge when I leave the room, constantly fearing that others will say unkind things about me to other people. Autism means being dateless on weekends, as well as constant loneliness, only watching TV on Saturday night. Autism means not being able to fit in on social peer relations. In spite of the negatives, there are positives. For instance, for birthdays, she has a calendar memory. She's articulate and she has skills. And she ends it by saying, all in all, I would rather be autistic than be normal. So it just shows that it depends on the severity of the autism. And also, we talk about the Autism Spectrum Disorders, where you can see as we go into the presentation, we use the abbreviation ASD. So when you hear the abbreviation ASD, we're talking about Autism Spectrum Disorders. And we talk about the diagnostic criteria. And these indicate the skill deficits in these areas, and that's on your handout also. And the only ones that I want to point out where we talk about the restricted interest, that means that the person, the individual with autism, they become fixated on specific item. They only want to talk about that particular thing. They could be hung up on trains, or they could be hung up on animals, a specific animal, lions or whatever. And then the sensory integration portion, that deficit, they're sensitive to the touch. It relates to the deficit in the areas of the senses. They're the students who may need to cut the tags from their clothing because they don't like the feel of the tags on their skin. They're very sensitive to the touch. When we talk about the spectrum, we talk about pervasive disorder, pervasive developmental disorders, or abbreviation for PDD. And when we talk about that, that includes autism, but it also includes 4 other related developmental disorders, and you have those also listed on your handout and discussed in detail. When we talk about PDD, it's widely used by professionals to refer to the children with disorders and with autism and related disorders. And there's a great deal of disagreement and confusion among professionals concerning that PDD label. And it's the diagnosis of PDD autism or any of the other developmental disabilities are based on the diagnosis that is listed in that DSM manual that we talked about.
So now that we know what autism is and have a basic definition, let's move into what interventions do we currently use with students. I've had a student, we worked on the alphabet. We needed him to identify A, B, C, whatever letter I was showing. Couldn't get it. I'm ready to bang my head on the wall. But what I discovered was he could give me an object that started with that letter. So he never could tell me A, but if I held up the letter A, he would say apple. If I held up a bird nest, Or if I held up a letter N, he wouldn't tell me N, but he would tell me nest. For Z, he'd tell me zebra. So I knew that it was in there, and he was actually beyond where we would think, getting the letters, but he had associated it. You had talked about social, how you notice some people have difficulty socially, and that can be very true, but those same people that cannot talk and carry on a basic conversation could be very brilliant, making great grades, doing very well academically. So they may be academics, social, so you see that uneven development. And that could go across for your cognitive, your communication, your social, adaptive, and even motor skills. Kids that cannot walk from one end of the room to the other without tripping, but are wonderful artists. So different gross motor, horrible, fine motor, great. Okay. I want to talk a little bit about cognitive functioning in autism. Get to talk about the brain. Lots of brain research going on, and that includes brain research in autism. We do know that it is a neurological disorder, but we do not know the origin. We know it involves the cerebellum, which that is the part that affects fine and gross motor, your balance, and muscle tone. We know that it affects the amygdala, and that's the emotion part. And we know that it affects the hippocampus, and that has to deal with memory ideas, spatial concepts. One of the interesting things that we have noted as they measure head circumference, the size of the head, they're starting to notice a pattern, and it's not in every child, but a lot of students with autism have larger heads. So you would think larger brain, but in fact the opposite. The brain size is actually smaller, even though the head circumference is bigger. Do want to note though, with our kids with autism, trying to come up with an IQ or find their cognitive ability can be very tricky. Because without the social, it's hard to ask some IQ kind of questions. It's hard to get what they truly do know. So a lot of times we will do, instead of a regular IQ test, we'll do nonverbal tests, we'll do observations, lots of different things so we can find out what they do know.
When it comes to autism and the social skills, as you recall when we were talking about the DSM criteria, that they recall that it indicates deficits in the area of socialization and social skills. And based on the criteria listed in the DSM, they indicate that they have a qualitative impairment in social interaction, and this can be manifested in at least two of the following. They may have a marked impairment in their use of multiple nonverbal behaviors such as eye-to-eye gaze, their facial expression, their body postures, or gestures to regulate their social interaction. They may fail to develop peer relationships, and you talked a little bit about that. There may be a lack of spontaneous seeking to share enjoyment. They have a hard time relating to other people, being concerned about what other people are talking about and just focusing on what they're fixated on. They may lack social or emotional reciprocity. Their interactions are more one-sided. They don't have that two-sided interaction that we do. And some of the social skills acquisition and demonstration may be significantly different from their age-appropriate peers. And this may be in the areas of eye contact. It could be greetings, being able to initiate or maintain a conversation with others. And they also lack the other pleasantries. They have a hard time knowing how to end a conversation. When they're finished talking, they just turn and leave, instead of knowing that you have to say something before you close out your conversation. And they have difficulty in the area of coping skills, and this may manifest itself in frequent meltdowns. And the lack of limited social skills may be the result of the uneven development that Tracina talked about, but also their low awareness of their environment and the low ability to be able to model And when we talk about autism and motor skills, Dr. Paula Kluth, she is on the Inclusive Education Conference for the New Millennium, and she talked about that she indicated that there are areas that are difficult for children with autism. And the neurological disorders may manifest themselves by limiting or interfering with messages to switch. That means to be able to change direction, whether it's large or small motor movements, or to be able to combine two or more skills at one time. They have a difficult time walking and talking at the same time. Or it could be a difficulty in the area of being able to continue. They have difficulty with the smooth transitions from one activity to another. And to be the inability to stop. Once you start a movement, you'll see students who will start running and then they have a hard time stopping. You have a hard time calming them down. So based on the work of Ann Donaldson and others, it points to a new way of understanding autism by examining their movements. They suggest that people with autism, that they have a different way of experiencing actions, emotions, speech, thoughts, and memories in a different way than those who do not have autism. And we get to the point of what autism is not. It's easy to say what autism is, but what autism is not. And it has been suggested that autism is the result of poor parenting. This is not true. But if all else fails, you blame it on the parents. It also has been said that kids with autism are just unruly kids who have behavior problems. This goes along with the previous one. This is just not the case. Individuals with autism, they see them as a group of savants. And they are the ones who are portrayed in the movies, The Rain Man, and Hollywood makes a lot of money off of these characters. And then there are some who are like Temple Grandin. I don't know if you're familiar with her work, but she is an individual with autism, and she's very successful. And she credits her teachers and those who have worked with her for her success, because she said that they looked beyond her uniqueness and saw what she had. She saw her skills. And Temple Grandin, she's a doctor. She has her doctorate, and she's a designer of livestock handling facilities that are being used all over the world. So she has lots of skills.
Next, we wanted to talk a little bit about what is IDEA, and that stands for Individuals with Disabilities Education Act. It was passed in 2004, and it strengthened the emphasis on inclusion with students with disabilities into general education curriculum. Prior to that, so many times our students with special needs would get shipped to the little classroom down the hall, and they'd all learn in their special little group, or we would only see them at art, music, PE. And IDEA came in and said, it is best practice to have the students around their peers, to be able to have the general education curriculum taught to them. And so that strengthened with IDEA. And also the accountability was something that we call No Child Left Behind, is also in there. IDEA 04 talked about autism being a developmental disability, which we talked a little bit about in the diagnosis of the DSM-4. It did note that it doesn't apply if the child's primary disability had to do with emotional disturbance, then it would not, that would exclude them from the autism. And it noted after age 3. However, since then we have noted in research that we're starting to see signs as when kids as young as their first birthday, not looking when their name is called, not able to make eye contact with mom and dad and those around. So this is what the law says, but in just those few years we have learned even more than that. And you do have a handout also with this IDEA on it.
So often when you attend conferences or workshops, we get a lot of handout and materials that we really don't have time to go through. And when we get home, what do you do with it? You put it on your shelf. So today we're going to take the opportunity to go over one guide that we have included in your handout. It's called the Puzzle of Autism. And this is a guide that you will find to be very beneficial. And we're going to spend some time going through pages of it so that you can get familiar with what's in it, so that when you leave here and you need to know something about autism, you will know where to look. And we will start off by previewing pages 1 through 3 of your guide, The Puzzle of Autism. And I want you to record the top 3 pieces of information that you believe impact your role in education. And as you look on your next slide, your PowerPoint, it says there's some of the things that we have identified, 3 of the areas that we have identified that impact our roles as educators. Teachers needing or educators needing resources and information. There's a lack of information, and teachers feel that they need to know in order to adequately serve students with autism. And also educators feel that they have little experience and little training when it comes to dealing with students with autism. And in the general education classroom, it's important that we pay attention, special attention, to the physical aspects of the classroom. And when we talk about the physical aspects, we're talking about the furniture, how it's positioned. A lot of times we make sure in some classrooms that some of the teachers you will see cut tennis balls in half and put them on the ends of the tables, at the chair legs, so that they won't have that noise that is especially painful to students who have autism. And also to be aware of the antecedent behaviors, their attitudes, and their beliefs. But also, and this is the most important, to capitalize on their strength, because all students, even students with autism, they have strengths. And it's important for us as educators to find out what those strengths are. And one way of doing that is in our conversations with the parents or caregivers, that if we make sure that we know what it is that they enjoy doing, what their strengths are, then we can make sure that we use those preferences in our instruction of that student.
So knowing a few of those things, we're going to move into section 2, features and strategies. So what I would like you to do next is look at your book on pages 6 to 9. And I would like you to underline any things that you think would be something that you could use in a classroom, or if there's individuals you know with autism in the community. Just underline a few of those. Something else that I wanted to point out, class routine. It's amazing just having consistent routine so the students know what to expect, how that can make life go easier. And grown-ups are like that too. I mean, what happens if they took Grey's Anatomy off of Thursday and put it on a different night? That messes us up as well. So we like routine as, you know, when that routine changes, that's a little trickier. So something else that was mentioned in there was the visual menu. And so if you know things are going to change, you might have pictures of how your day normally looks. Like we always start with writing first, and then we do our journals, and then we do, well, if you know there's going to be an assembly, you better find a picture of the gym or wherever you're going, stick that on there so they know what to expect. So that can also be a great strategy. All right, let's move on to communication.
Section 3 of your guide deals with communication and comprehension. And I ask that you would just scan pages 12 through 13 of your guide. And they're talking about teaching a social studies lesson. And the student with ASD, or the Autism Spectrum Disorder, is not paying attention, but you believe that he or she is capable of doing the material. So what can you do to engage the students? Just scan those 2 pages and come up with some ideas as to what you can do to get that student engaged in that lesson. When we talk about some of the strategies that we can use for that communication and comprehension, we can pre-teach new concepts. That's what we call front-loading, because what you're doing is you're familiarizing the students with a new topic before you begin the actual lesson. And when you do this, it has a way of easing that stress level so that they're not as anxious when it comes time to doing the lesson. You can also do modeling. After going through the verbal instructions, you can hold up a book and show them the correct page. Say, for instance, if I say turn to page 12 and 13, if I hold up that guide and show you on page 12 and 13, you would know what I wanted you to do. And you talked about the visual reminders, allowing the student to be able to self-check so that the student will not have to rely on an adult or a peer to let them know when they're in the right place. And auditory signals, you also came up with that one. So you did a good job of finding them. And then also, when you have multi-step instructions, to make sure that you break them down into the smaller steps so that the students will be able to handle it. Now I'm going to ask, we're still in section 3, that you scan pages 14 and 15 and give an example of how you would use one strategy to help students express what they know. We're talking about the expressive communication. I was listening to the conversation, and one thing that you pointed out on when you talked about communication, to develop a functional communication system, and that is extremely important because one of the primary goals of any student with ASD, it could be using picture boards, or it could be computerized devices, but some way that they can communicate expressively. And this will cut down on that anxiety, because a lot of their frustration is because they cannot communicate well with others. And also to model the appropriate language, but to create fair assessments. A lot of our assessments rely on essays and short answer questions, and this is not an area where a lot of students with autism excel. So we may want to look at doing more of the multiple choice or using a word bank so that they can capitalize on their excellent memories, because a lot of them, they do have the excellent memories, and they will be able to provide the answers when they see it in a word bank. And you talked about using the graphic organizers and providing the communication supports.
Okay, we're going to move into section 4, sensory integration and regulation. I have a lot of friends, family, educators who've asked, I just don't understand how wearing long sleeves can hurt the student. Why is that such a big deal? You know, and I'm like, well, the feel actually hurts them, and they're not understanding that. So let me give you a scenario and see how this feels for you. There's always one in every group that's okay with it, but how many people here like chocolate? Yes. So if I were to give you a Hershey's Kiss, would that be satisfying to you? Yes. What if I gave you the Hershey's Kiss and said you had to eat it with the aluminum wrapper on? Do you feel that in your teeth, how a lot of people, it just hurts me. I just tingle thinking about it. That's kind of what our students with autism might feel. For us, clothing's not a big deal. For them, it might make their skin feel funny. Some older students have talked about how it kind of feels like their arms tingle all the time, and that's where they like either the deep touch, or they like to be hugged hard. Some like the light touch because it makes the tingles go away. So that's kind of when we talk about sensory integration where we're going. You'll also see the chewing, the wiggles, those kind of things. So if you can look on pages 17 to 19, I have a few questions. I'll run through the questions and then I'm going to give some different questions to focus on. So the things I want you to think about. What could you do to improve the physical layout of your classroom? What movement activities could you allow to promote task engagement and focus? What accommodations could you use to assist in a writing lesson? What accommodations could you make for sensory sensitivities? And so if I can get you to read through your pages 17 through 19, I want you to focus on what you can do to improve the physical layout of your classroom. Give you some time to read and discuss it and then share out. If you guys can look through your 17 through 19, and I want you to focus on what movement activities can you allow to promote task engagement and keep the focus. Everything needs its own spot, and labeling is really good. Little guys still might need pictures of what's supposed to go where, like all the pencils, put a pencil, picture of a pencil on it. But you don't want to go crazy, because if there's lots of things to look at, that can actually backfire on you. So you definitely want kind of an organized classroom, but not a chaotic. Yes, I've even seen at the high school level where there were students who would go out 2 minutes ahead of time so that they had the extra movement in the hall before the halls got crazy. Something else for fidgeting, I have kids with autism in my classroom. I have kids that do not have autism, have other diagnoses, but stress balls, everybody, well, not everybody, a lot of people like stress balls because you can just sit and fidget, not get in trouble. So that is something. I have one student who loves puffer fish. So we went and got him a stuffed fish, and he can sit for the entire carpet time if we just let him hold his stuffed fish. You take that fish away, and he struggles. So something as simple as finding an item that goes with their interest. And I don't know if you've seen any catalogs or different kinds of chairs, because there are so many choices out now, but there are things called T-stools, and it's just, you've got one base and your chair. They're actually like old, there's probably not any farm girls in here, but what you would milk a cow with, just the one T. It looks like a T. The trick there is, though, you have to be able to balance it, and in balancing it, you're getting a lot of your wiggles out. We've taken that and found out that also sitting on like the exercise balls does the same kind of thing. So they don't have to be just in the PE room anymore. We can bring them into the classroom and use them for good. One of the other questions had to do with writing, ways to assist in writing. It takes a lot to write if you think about it, because you have to know what you want to say in your mind, and then you have to get your hands to do it and to get on the line and to make it dark enough and not to push so hard that it goes through the paper. So one thing that a lot of students, especially when they hit middle school, upper elementary, the use of computers. If writing is a horrible task and your whole goal isn't to get the letters to look perfect, but to find out what they know, let them use a computer and type it out. Or let them tell the teacher their story and the teacher can type it out. And the last question had to do with sensory activities. You had talked about how to set up your classroom. I encourage everyone setting up a classroom to also think about a safe spot that might have some sensory things in it. So if they know that you can see they're getting anxious or they just need a break, that they could sit over in a separate area, and maybe there's a box of just gadgets and things to calm down, or they just need some time away. There could be just an empty desk so they could have some time to themselves to cool off.
And to allow a part of your instruction to be to get them to the point where they recognize when they need that space, when they need that wiggle time. What we can we do what's called teach, rehearse, reinforce, and repeat. And it deals with a lot of the things that you talked about, but also to teach social skills training. And you can use, with a lot of students with autism, they use social stories. And this was pioneered by Carol Gray. So that is one way of getting them to talk about a situation before they're in that situation. If you know that the student is going to have a hard time when they go out for recess on the slide, then do a social story regarding that. You know, when I go outside and I go near the slide, I will breathe deeply 5 times before I walk, you know, that kind of thing, so that they can rehearse it before they get to the actual situation. So when we talk about teaching the conversation etiquette, you talked about going in small group and teaching it in small group before you do with the large group, but also to understand that you will have to teach the students about personal space. A lot of times they will get too close to you. They'll get right up in your face and start talking. They don't understand that my space, your space kind of thing. So to be able to teach them that, and to teach them not to speak too loudly when you're standing near someone, or too soft that they can't hear. So all of those skills that we take for granted with students with autism, we have to do the teaching.
Okay, now we're going to move into behavior issues in section 6. This is one that can cause a lot of stress to educators, whether it's a classroom teacher or a paraprofessional or a principal or the parent when they get home. So this is one we might spend a little bit of time on. If you could look at page 26, and I'm going to give you something to think about. As you scan through that, I want you to think of what you could do if you have a student who becomes aggressive and refuses to move during a fire alarm. So as you're looking through there, be thinking about that. But yes, ahead of time, going through the social story. This is what a fire alarm looks like. This is what it's going to sound like. When I hear the noise, I'm not going to get upset. The noise is to keep me safe. I need to stand up and leave the room. I act calmly. And you can also pair it. I mean, a lot of social stories have pictures, but if you have a lower student who's not doesn't have the language skills maybe to do all that, you can do it in pictures and take pictures of the first fire drill or a different school doing their fire drill or what it looks like to kind of desensitize them. With any behavioral issue, it's always best to intervene early, especially if you know it's something that's coming up, to plan ahead. We talked about visual schedules. Make sure that's on the visual schedule if you're able to put that in there. Also, we talked earlier about the teaching, reinforcing, modeling, what situations are going to look like. Same thing here. Sometimes you just spend practicing with the whole classroom what it's actually going to look like. So it's like you're doing a drill for the drill. So he can see or she can see the peers doing it as well. Something also is always use clear directions in a moment of chaos. We don't want to confuse our students. Another situation we had is a student, he had some lovely language he liked to use. And one of the phrases started with an F, and the second word was you. So you can imagine what that was. Now, when you have a substitute that hears that all day, that's not always so happy. Or when the principal comes in when you're being evaluated and they say that, not always so good. So another way to work with behaviors is through giving them something to substitute that behavior for. So obviously we didn't want him saying F you. So we worked on every time he'd say it, we'd say, no thank you. And he heard it enough to the point, it took about 1.5 years, but instead of that phrase, he now says, no thank you instead. Now, if we would have just taken away the words from him, I don't know, we would have gotten silence because he needed to share that he was upset or mad or angry. But by substituting, we were able to get to no thank you. which sounds so much better when the principal comes in. Yeah. All right, let's move into restricted interest in Section 7.
Section 7 talks about restricted interest. And just want to let you know that restricted interest is covered in details on page 27. So you can read this whole section, this whole page at your leisure. But right now what I want you to think about is we're going to talk about this student named Chris. And during a math lesson, Chris interrupts the class and he starts talking about elevators. He tells everything that he knows about elevators. He will not stop. The elevator talks just goes on and on and on. So what can you do? What strategy do you think you might use with Chris?
Bringing an elevator math problem.
Okay, bringing in an elevator into the math problem.
Like maybe let him talk about elevators for a little bit, but then try to ease something else.
Okay, okay. Let him talk about it for a little bit.
A timer.
You hit on the primary ones, and that is to make sure that you use what his preferences are. Use it as a teaching tool. You suggested bringing the elevators into the math problem. That's very easy to do. But also to use pre-correction as a teaching technique. And that's where you state the appropriate behavior for the lesson or the activity that's to come up. Or you can list it on a visual, on a chart or something, so he'll have a visual of what he is to do. But you had some excellent suggestions.
Okay, we're going to move from some of the activities in the book into, we're now ready to have our students' annual IEP meeting, which stands for their Individual Education Plan. And we have the parent, we have the educators, we have the principal or counselors, depending upon who's on the team that's needed. What are some goals and objectives that we need to discuss and cover during the IEP? One of the things that I think is so important is independent living and functional skills. Now, I teach 3, 4, and 5-year-olds, and you're thinking, yeah, independent skills. Well, I'm here to say if we don't start when they're 3, they're going to be doing the same things, or the parents might still be doing the same things for them. So the earlier that we can teach them the independence, the easier it is when they get to elementary, middle school, high school. So something as simple as making sure they take up their own breakfast tray, where they're responsible for something. That's also when we need to look at the academic skills. What are skills that they are going to need for academics, but are also age-appropriate skills? Because we don't want our middle school students still working on alphabet and their peers seeing that that's what they're working on. So sometimes we have to be a little creative, but we want to find something to challenge them that looks more age-appropriate. And I know there are some book companies that do have topic of books, but they are written at a lower level. So there are some opportunities for us to come up with different activities that look age-appropriate. Make sure we include appropriate social behavior skills. Sometimes we have to write a behavior plan or a positive behavior support plan, depending upon what the states or your local education agency calls it. But we always want to look at that in a positive. What are the things that we can do ahead of time to help our students so we don't have the meltdowns? And you need to spell it out and put in specifics as far as the things that you can do before, during, and after if those should happen. And then including functional communication skills. One thing, and Mary's going to discuss a little bit more in a minute about transition, but I wanted to look at transition from a little kid's standpoint because it's a little different from going out and being ready to get a job. But our kids transition depending upon the school district every couple years if there's a different building. And so for students who like things the way they like them, and they know everybody and that's comfortable to them, it's hard to move to a different building. So in this IEP, when we know that that transition is coming up, I really like to discuss with the teacher that has a student currently and have a teacher who might have the student in the future there, so we can discuss, do we need to videotape what the new building looks like? Do we need to make a scrapbook of who the new teachers are? Different transition ideas to smooth things over. And with the parent there, the parent's going to know best what works for students and what doesn't work. So I think it's important that we look at all aspects and not just all the little required things.
When we talk about transition as it relates to post-secondary skills, we have to make sure that the goals and objectives that are on the IEP are preparing the student for when they finish high school, when it's time for them to go to college, or when it's time for them to get a job, to make sure that we have properly prepared them for the skills that they will need when they go out into the vocational world. And we have to understand that the transition, preparing them for that, it doesn't start when they get into middle school, although that's when you have to do the transitional plans in a lot of the school systems. But it starts at an early age, because the more that you can get the supports in that they will be using, the better able that they will be able to perform when they finish school. So we have to make sure that they're able to use those supports that we have instituted during their school years into their new environment when they go out to seek jobs or when they go on to higher education. And we also need to make sure that the people who are going to be involved in their post-secondary life are included in that transition planning of the IEP, to make sure that all of the people in the community that will be coming together, the community service boards and anyone who will be helping them in finding jobs or going on to college, making sure that they're involved in the planning. On your handout, you'll see a diagram about across the lifespan, and it talks about a seamless transition. And what they're saying in this is that transition is a seamless, ongoing process from birth all the way really to death. It goes through, as Tracina was saying, from the early childhood to elementary school, elementary to middle, middle to high, high to post-secondary, or to the universities, or just getting a job. So it's important to know that transition does not just mean that they're going to go out and find jobs, but it can be, as Tracina was sharing, from building to building.
And that would include for our more severe students that would need group homes. What skills do they need to live in a group? What skills do they need to live at home with parents? Sometimes we even forget teaching them how to fold laundry or how to do dishes.
And a lot of times with students with autism, that we kind of sell them short when it comes to their skill. I had a student at one time who his communication skills, his interaction skills were not his strength, but he was able to work on a computer. He could do programs on a computer that I couldn't do. So to let them know that they can use the strengths that they have in a vocational setting. So right now he's able to get a job working, as long as he's in his own little cubicle working on his computer, he's fine. So to make sure that everything that we gear their vocational skills to what they're able to do, to their strengths. And when we talk about the role of the LEA, which is the local education agency, that's your local community, your local schools, and they have a role in the students with autism in their planning and in their education. And some of the things that they need to do, the LEA can serve as a leader in accepting not just the students with autism, but all students, to make sure that we get to the point where we don't say your students or my students, they're our students, so that they're not singled out. and also to be sure that we have an open communication, especially with the schools and with the parents and with the service providers that they would need throughout their education, and to ensure that the educators have the materials and the instructional support, and even to have the professional development built into the IEP. If they're going to need one-on-one support, then put that in the IEP so that they can be sure to get what they will need in order for them to be successful. So to have that common planning time where you have the opportunity to come together, general ed teachers and special ed teachers, and just come together and provide what is best for those students.
We want to close with some online resources. There are a few listed in your handouts. I do want to caution, the ones we have listed we know are very reputable. You can go online and type in autism and you will have reading from now till forever. But you never know who has written or where they got their information. So I just caution you to use sources that you know are reputable. And so we have listed a few. The Autism Society of America, the Gray Center, when we talked about Carol Gray, is listed. There are also some print resources. Everyone here with us today received the Puzzle of Autism booklet, but if you want to give one to everyone in your family, you can download this and print it off so you could give it as Christmas presents next year if you wanted. That is available. And it also lists some books. And there are some good books also if you go to the bookstore. Some of our students who have gone through school have now written books about what it feels like to have autism. There's lots of good things out there. It really gives us some insight as to what's going on in their bodies. And I'm just going to read the essential questions, and I want you to think about if we have covered those, or if you have additional questions, be jotting those down so we can get to those. What is the definition of autism? We spent some time on that. What are the characteristics of students with autism spectrum disorder? What are some effective strategies and practices for teachers? Which we spent a lot of time in the book, so hopefully you feel like we've covered that. And what resources are available? And I do want to note in the back of the Puzzle of Autism, there are some resources listed there as well.